I am Dr. Jeevanandam, Professor in Pharmaceutics, Sri Sanmuga College of Pharmacy, Sangagiri, Salem District. Today we are going to discuss about drug absorption from various routes of administration. What are all the influences in routes of administration regarding drug absorption? We are going to see the classification and few drug absorption routes which influences the drug absorption. So first, route of drug administration classifications. So it was classified into two different main areas, systemic and local. So systemic was classified into further enteral and paraenteral. So enteral, it was categorized into oral, sublingual and rectal. Paraenteral, inhalation, injections and transdermal. And second main classification is local. In local, it was classified further into skin topical, intranasal, auricular, drops, mucosal throat, vaginal, mouth and ear. So further, the paraenteral and local coincidence was there in inhalation and transdermal. So the further paraenteral injections has been extended into intravenous, intramuscular, subcutaneous, intra-articular and intra-arterial, intrathecal and intradermal. So out of this, first we are going to see few examples and which has been picturized here in enteral and paraenteral. So enteral, first one oral, sublingual, sublingual is also called as buccal, rectal and entry coated tablets and entry coated formulations which is categorized under slow release formulations. So paraenteral IV, IM, SC, ID, IT, etc. Different rates of absorption, different plasma peaks and IV infusions, it has different time interval difference in absorption. Skin. Skin is nothing but a topical route. For local or systemic effect, no patches are used in this. Inhalation. Inhalation through lungs. Local or systemic effect will be there. Vaginal. Vaginal usually local by using suppositories, tertiaries, bogies based upon the reproductive system of human. It was defined for females, vaginal, tertiaries are preferable. Eye drops and eye ointments are prepared. It was picturized and few examples for sublingual, inhalation, oral, transdermal patch, rectal and paraenteral. Topical has been picturized in the side. And before entering into detailed discussion of paraenteral and enteral routes, few factors are there which governs the route of administration. Uh, they are few like factors. We have physical and chemical properties of drugs, especially if it is in solid dosage form, liquid dosage form, gas, based upon its solubility, stability, pH irritancy. Lot of factors are there, physical and chemical properties. And site of desired action. Which site, like it is localized or approachable or generalized and non-approachable. Site of desired action is different. Rate and extent of absorption from various routes depends upon the route, whether it is enteral route or parenteral route. The extent of absorption, drug absorption will differ. Effect of digestive juices and first pass effect. Rapidity of the drug response, emergency or routine. Accuracy of dose or dosage. Condition of the patient. So these are all the factors which decides to select the route of administration, whether it is enteral or paraenteral. So this is an outlet of factors. And first, we are going to discuss about oral route. The most common route of drug administration is oral route. So you can see the picture for an example, like swallowing through the mouth. Drug is given through oral cavity. Majority of the drugs produce systemic effects, expecting a few which are administered for local effect. Example, antacids and antidiarrheal drugs like norfloxacin, streptomycin, sulfathiazole, pectin and chiral. So these are a few examples drugs given in oral. What are all the advantages by enteral route? First we discussed about oral. Advantages is safe, convenient, self-administration is possible, pain-free and non-invasive and easy to take, economical compared to other parenteral routes. Usually good absorption takes place along the whole length of the GI tract. No need of sterilization, no need for sterilization. So that is an important advantage. But disadvantages, when we move to disadvantages, so there are several disadvantages. Slow absorption, for example, in unconscious patient, emergency condition, slow absorption leads to slow action, so the recovery will be less. Irritatable and unpalatable drugs, nausea, vomiting may be there, cannot be used for uncooperative patients, unconscious patients, and those who are having vomiting sensation. Some drugs destroy in oral route. Sometimes inefficient drug absorption may be there. Some drugs are not absorbed, for example, streptomycin. First pass effect due to biotransformation. Food drug interaction and drug drug interaction. These are all few disadvantages in oral route, especially classified comes under enteral administration. So, what are all the drugs given in oral dosage forms? Common dosage forms administered in oral administration are listed over here. The pictures are shown like tablets, capsules, liquids, solutions, suspensions, syrups, elixirs. So these are all few oral dosage forms which has been administered in enteral routes. So in oral route we can have subclassification and its discussion. Sublingual route. Sublingual is nothing but in the mouth, under the tongue. So sublingual administration is where the dosage form is placed under the tongue, rapidly absorbed by the sublingual mucosa. In this route, what are all the advantages? Economical, quick termination, first pass avoided, drug absorption is quick. So GIT transformation is not there. Directly it will reach the circulatory system. That means that first pass metabolism avoided. So this is main advantage. If it is not palatable or discomfort for the patient, quick termination is possible. And economic disadvantages. What are all the disadvantages? Maybe unpalatable, bitter in taste, irritation of mucosa, oral mucosa, large quantities not given, few drugs are absorbed, few drugs are not absorbed properly. So this is main disadvantage in sublingual. Next, come to buccal. Buccal administration is where the dosage form is placed between gums and inner lining of the cheek. That is called also called as buccal pouches. So the dosage form which is administered in buccal route is called as buccal pouch. So absorbed by buccal mucosa. So the picture shows when it is applied, you can see the picture A, it's just applied. After 1 hour, it absorbs some mucin and it shows some bulginess. And C, the photograph C, after 5 hours, it got disintegrated. After 10 hours, just like a few traces are remaining, the disintegrates and dissolves in the blood. So the absorption will be good. So in this advantages and disadvantages, first pass metabolism effect will be avoided. That is advantage. Rapid absorption, drug stability. Disadvantages, inconvenience. Advantages, last if swallowed. If the patient swallows it, release pattern will not be observable. And small dosage limit is advised in this route of administration. Thank you. As a continuation, next session we will continue with para-enteral and few enteral routes in the next session. Thank you. Thank you.